Can you share your insights about the benefits, the challenges of how we measure outcomes and, the
Mm.
work that we do here at Mingle?
We've got the outcomes for the organizations as far as the quality outcomes or their cost outcomes or and sometimes that's measured in a MIPS score. Sometimes that's measured in performance across a given measure that the organization just wants to focus on. It's always, in my mind, let me go to the second layer. So the second layer to me is the value that we are bringing the organization as far as what we at Mingle Health can bring. And that second layer is always defined by what the client needs and what the client says it is. Because I the consultant team is brilliant. There's some really brilliant minds there, and we can do anything. We can analyze anything. We can show you anything. But if what the client needs is just the first step, if what the client needs is, man, I haven't done anything in value-based care and I just need to get through the MIPS program unscathed. Can you just show me how to
Hmm.
navigate this? Absolutely.
Hmm.
Absolutely, we can do that, right? And then you've got the next layer or the next level up, which is, hey, I'm a leader of an ACO, and I've got to figure out, where are all my patients leaking out to
Hmm.
because they're, I'm losing track of all the fingers because there's so many practices and so many disparate data systems. And how do I see it just in one place? um, and that is a different kind of
Hmm.
value
Hmm.
that I think we bring. But again, that level of value I think is always defined by the client. The level of value that is, what are we doing for these patient populations as we're interacting with practice managers? That's value to the patient. That's value to their community. And I think that can be, I don't hate to say the word valuable again. I'll illustrate it with a story. We have a client that we were working with in a more definitive way than we usually do. So this is a client that we have access to their EMR, right? So we can see, and we're helping them go through their, here's a measure, here's METs, here's not METs. We know that in this particular case, the METs mean we've delivered the appropriate care, and we're hoping that's going to lead to a better outcome. And so we're looking through the not METs to see, well, why are they not met, right? Is it a data issue? Or is it truly, it was just a clinical miss? I mean, clinicians are humans, so clinical misses happen. Um, and there are times where you're like, okay, well, that was a clinical miss. Maybe you can catch them next time they're in, right? There's some measures that allow you to be like, well, can you go see the patient? Can you see what's going on
Hmm.
there? Right. And it was a smaller practice. And when the EHR brought up the chart so that we're taking a look and like really diving deep in, it has a little picture of the patient. And the picture of the patient was this sweet, sweet man who looked like somebody's grandfather. I've never seen such a lovely smile on his face. And I absolutely could have in that moment said, "Yep, you'll catch him next time," and moved along. And instead, I sent a message to the nurse practitioner and said, "Hey, did you know that, this patient is missing a beta blocker and they had a heart attack last year and they really do need to be on one?" And I just felt like let's just close the gap right now if we can,
Hmm.
right? Overall, the value that we bring is a much higher value, right? Overall, it's let's close the gap on 2,000 of those grandparents
Hmm.
so that so that then overall the community is healthier. But I think it's okay every once in a while to also be like, that guy. I'm worried about that guy.
Yeah, but I mean, it's those little moments
Mm.
of everyone choosing not to dismiss the box. I mean, some of the programs that we service, the reimbursements are more flexible. So it's not even the clinician that has to take action. It's the care
Yes.
manager, the front office staff. There's a whole variety of folks who play a role.
Yes. And that's a huge conversation in healthcare too, especially in the clinic environment. In many cases, the clinician is sort of the captain of the ship. especially in a clinic environment, right? They should be directing that care. But can they effectively direct that care if, you know, in volume-based care, we load them up with more and more patients, which brings us more and more payers to have to understand, which means more and more front end staff. In order to pay that front end staff, we have to see more and more patients. And so then the time with each patient is getting shrunk, and there's more pressure on the clinician to get through as much as possible. That's not sustainable long term. If you have a panel of patients, and that panel of patients you're responsible for keeping as healthy as possible, then we've got a whole team of people at the practice that can help with that. Then we That's when we're really leveraging our office managers and our our MAs and all of those different workflows that touch the patient. Um, you know, Patients in general don't magically change the course of their chronic conditions as a result of a pill that we give them
Mm.
or an instruction to go exercise, because those are lifestyle changes. But what does make an impact to lifestyle changes is relationships. So if when that patient comes back in and they have their blood sugar log, or they're told to call their blood pressure log in, they're talking to the nurse at the back desk or the MA, or right, they're having these conversations with more than just one person at the practice. So then everybody is coming together to kind of help elevate the outcomes for that person.